My name is Mutile Mwongo. I am the Research, Knowledge and Systems Practice Associate at Development Dynamics. And we are once again partnering with Food for the Hungry on our Systems Practice for Social Impact series. This is the second episode, and we are really glad to have you in this session today. Before we get into the meat of things today, we'll just go through a bit of housekeeping. So how it will go today is we're going to start with the welcome introduction, a bit of a recap on what we discussed in the previous episode. Then we'll go into the panel discussion, followed by a systems thinking exercise, which was very interesting last time, and we hope it will be as interesting today. And then we'll reconvene and exchange some thoughts and what stood out from the session, and then we will close. So that's the flow of today. We have a really amazing set of speakers and panelists today who you will hear from. You'll learn about their experiences, why they do what they do. And yeah, we just hope that this will be as interactive as possible. So without further ado, I'd like to invite Felsha to tell us a bit about what Last Thursdays is and why we hold this convening at Development Dynamics. Over to you, Fel.
Thank you, Mutile, and welcome everyone again to this edition of Last Thursdays. My name is Felsha Achieng, and I'm the Senior Associate for the Insights Hub and Product Development. And I'll shortly take us through what Last Thursdays is, as well as do a short recap of what our last edition was about. So Last Thursdays is a monthly convening designed to encourage peer-to-peer learning, collaboration, and innovative thinking within the development and innovation landscape, which is where most of us work in. And as the name implies, every last Thursday of the month, we religiously bring together thought leaders, practitioners, and enthusiasts to discuss a wide range of topics that shape today's social impact and development sector. And this ranges from movement building, intersectional feminism, there's impact management and measurement, and so on and so forth. This edition of Last Thursdays is the second of a series that we had begun last year on systems practice for social impact, and it's in collaboration with Food for the Hungry, as Mutile has just mentioned. And part of the team from Food for the Hungry is here with us. And while today's session dives deeper into systems practice, the last session set the pace for us to understand systems practice, and it covered some key concepts such as interconnections, types of problems, mindsets, and mental models, and as well as just experience in systems practice. And so just like we're doing today, the session included a brief introduction and a presentation, a panel discussion, and an activity in breakout rooms, all of which are very insightful, and engaging. So today's session will be a step deeper into systems practice, focusing a little bit more on the tools used to understand systems. And this includes systems practice as a way to understand the root causes and underlying structures of issues, rather than just addressing events and symptoms and issues, and also introduce the iceberg model. Back to you, Dilly.
Thank you, Felsha. If we could go back to the previous slide. Yeah, so Felsha has told us about what last time looked like. And we basically, yeah, it was an introduction to systems practice. We touched on some key concepts and principles, and we discussed mindsets and mental models and how they influence our way of thinking and our way of viewing the world. And they're really the first lens we have of how we approach issues. We also talked about how important it is to address the mindset and mental models and the beliefs that people have. And without doing that, it's really difficult to make any meaningful change at the system level. We also talked about interconnectedness, just the fact that nothing exists in a silo, everything is connected. And it's therefore so important to seek out those points of inflection, those relationships, and those interdependencies, because they all add up to something and they all generate the system and why it operates the way it does. And then we also finally talked about complexity and the types of problems. We found that there's a study which shows there are four types of problems: a simple problem, a complicated problem, a complex problem, and a wicked problem. And this was analogized using the cake, rocket, and child framework, which we explored a bit in smaller groups. And there were really some great discussions that came out of that. And yeah, I just wanted also to share some quotes that were made by the panelists. There was a really good one about how issues are complex because they have a human face. And so we need to remember that people are at the core of the work we do in social impact and development. And Claudia, who's one of our panelists, talked about how collaboration is at the core of systems practice. And therefore, it's crucial to leave your egos and your logos at the door. Break down those power structures so that we can collaborate and have meaningful conversations together. And then Maxi reminded us about how organizations are systems. In systems practice, there's quite a lot of focus on social change, but organizations are complex in themselves because they have different moving pieces, and people of different backgrounds with different beliefs work in organizations. And so it's interesting and useful to also think about organizations as systems. And kind of leading us to our conversation today, Alex talked about how one of the most important things is digging deeper to understand the root causes, the underlying beliefs, and just surface all that lies below the surface, the things that we don't usually see, um, but exist and really drive why things are the way they are. And so that's what today's conversation is about. We are continuing to talk about complexity, and you can see in this image how intimidating it can be. It almost seems like an insurmountable task once you stop viewing the world as linear. But systems thinking helps us to work through and work out this mess. But at the same time, it helps us to get comfortable with the mess because humans are adaptive, the world is constantly changing, and so mess will never not truly exist. So systems thinking just helps us to get used to these kinds of states of change. And yeah, so we're going to talk a bit more about this. And to start off, we're going to watch a video together as we did last time. And the video talks about the systems iceberg from a high level. And then following that, Yasmin will tell us a little bit about how she's used the systems iceberg. So let's watch the video. Next slide, please.
Imagine that one day you're walking through a green park. It's a lush oasis in your community where people come to play, to picnic, to enjoy the outdoors, and connect with nature. While you are enjoying the park, you look around and notice on the ground by the river a piece of litter. Where did it come from? Why is it there? And how can you keep people from littering in the future? One way to help answer these questions is to use a systems thinking tool called the systems iceberg. Systems thinking is the practice and reminder that everything we do, say, touch, or decide in this world is connected and interconnected to everything else. If we recognize this and include it in our decision making, we can take actions that support our values and build a more sustainable world. The systems iceberg is a tool that can help us better understand why things happen and discover how we can take action to create powerful change. Think about a real iceberg for a minute. Did you know that typically less than a third of an iceberg is visible above the water's surface? That means the majority of an iceberg shape is difficult to figure out. We need to dive below the surface to get a better understanding of what's happening. Just like icebergs in the ocean, a lot of what's happening in our world around us is hidden from our view. In order to effectively observe and understand why the things we see on the news, for instance, are happening, we need to surface these deeper levels of understanding. Plus, the better we understand what's happening, the more able we are to change it to make something new happen. The systems iceberg is broken into 4 levels. At the topmost layer, we have the events, or the things that we can see, the one-off things happening around us on a daily basis. If we want to create change on the events level, We often react to them to try and create immediate change, though it's often not long-term. Below the surface, there are 3 unseen levels. The first of these is the patterns level. If we string events together, we can recognize patterns as we begin to see changes or continuity over time. Once we find those patterns, we can try to create change by anticipating what will happen and making a plan to intervene. Patterns are caused by the systems and structures on the layer below. These are the mechanisms, forces, rules, and physical structures in our society that make it work like it does, like the pieces of a computer or the organs of our body, but for our whole communities and society. We can understand systems and structures, then we're able to redesign
Eliani,
them
could we
in a way
pause
that can
and
create
check?
patterns that we like and to change
Any?
patterns that we don't like. Systems and structures often occur because of our mental models, the bottommost layer of this systems iceberg. These mental models are our beliefs, our thoughts, and our values that hold everything else up and shape our worldview. If we can change people's worldviews, we can transform a system to create very powerful change. Imagine that one day.
Sorry, all that we couldn't see half of the video. I think the audio was sufficient though, just so that we stick to our schedule. So that was a video about the systems iceberg, and Yasmin is going to tell us a little bit more about that and what it has looked like for her. Yasmin is an ecosystem developer at Riasa, but I'd love for her to introduce herself. So welcome, Yasmin. Tell us a bit about you, and then you can take us through the next bit.
Sure. Yeah. Thank you very much, Mutil, for inviting me for this conversation. And thank you, everyone, for joining the session. I think the iceberg model is one of those frameworks that are extremely important for us to use, not just in the context of work, but in challenges that happen in our everyday life. So it's very useful, and I've facilitated several sessions on the iceberg model so far. So it's one that I'm very familiar with, and I really enjoy the simplicity, but also the deepness that it carries with it. So my name is Yasmin. I am an ecosystem developer at Riasa Co, an African institution that brings systems thinking, complexity science in an easy and accessible way for an international community, but also bringing the African culture to the surface and highlighting the culture and the insights that is within the African traditions, so more people can know about the stories and the narratives that have been in the continent for centuries, right? And systems thinking is a lot about narratives and sharing and collaborating. So it's a pleasure to work at Riasa. And I also host a local community here in Bristol, UK, where we discuss topics on systems thinking and complexity science in a local level, trying to bring the change and these discussions to the everyday experience of being in the city. So yeah, it's that's just a bit about me. And then next slide, I will share more about what I would, one of my passions as a topic is to talk about communities. And as we saw in the video, the iceberg model is great to trying to understand current challenges and for us to dig deeper and understand the underlying structures and mental models that support the events that we see every day. And we sometimes try to ask deeper questions, why? And the iceberg model helps a lot with that. But I also would like to share some experiences that I had using the iceberg model to envision the future, or what a better, a healthier, let's say, system can look like. So this is just what I'm going to try to do in 15 minutes, so I don't take too much time. So next slide, please. Yeah, so as we were talking about, this is how we normally use the iceberg model. We have a challenge, we have an issue, and we start at the level of the events. So what can we see? What is the phenomena that is happening and that we would like to understand a bit more about it? And then we go down into the levels. I won't extend myself too much in here. But then we try to look at the patterns over time, the trends that have been happening for a period of time, depending, we can talk about centuries, we can talk about months, it depends on the challenge that we have at hand. Then on the next level, we have the structures, the policies, the infrastructure that is supporting the event, the patterns and the events on top. And lastly, we have the mental models, the beliefs, the culture, the attitudes, the ways of being that are in the core of all the other layers, and that sometimes can be difficult to identify how these mental models actually support the existence of all these other patterns on top. So just a quick example here on the next slide, please. I've participated in a group where we started to see that people, contributors, were leaving the group, right? So this is the first moment that we started to think there might be a deeper issue in here. So we would like to investigate using the iceberg model. So the first level, the events, is people are leaving this group, and good people that are contributing to the development of the projects and the ideas that we're developing. And this is a problem. So we should dig deeper and try to understand what it is. On the level of the patterns over time, the trends over time, we saw there was a cyclical pattern that about every 2 years, a good person would leave the group. And the same pattern of how they feel when they join and when they leave the group was the same. So they start very excited, they start putting all their energy into the group. But then after these 2 years, they will always leave unmotivated, feeling like they didn't contribute enough, feeling frustrated about the time they spent there. So that was a trend that was interesting to realize. On the next level, the level of the structures, we went and asked these people, why do you feel frustrated? What happened? And they would normally say, I don't think I'm compensated fairly. That I feel like I'm working in silos, as Mutil said, they mentioned last session about the siloed work. So people felt like they weren't just doing their job, they weren't to the wider cause, and they didn't feel safe in that space. So those are in the level of structures and policies that were sustaining all these other, the patterns and the events of this situation. And lastly, on the mental models, I like to think of the mental models of what would they say, right? And the narrative here is, I am undervalued. My voice doesn't matter. No matter what I do, I'm not going to be heard. So I can't aim for a better position in this group. I would just do my job, and I don't have any prospect of what the future can look like. So these are narratives that they carried with themselves, based, of course, on the experience of these 2 years in being involved in the group, which led them to leave on the events level, right? So that's a big problem. It's not just hiring more people that is going to sort this out. We would need to start from the bottom, in this case, from the core of the causes and the core of the issues that we're dealing with. So that's when if you can pass to the next slide, please. This is when, in some ways, we use the iceberg model in an inverted way, in an inverted manner. So to try to understand what the future can look like, what are the prospects of this challenge, we normally start from bottom up. So what are the narratives that we would like people to have? What are the core values that we would like them to perpetuate in order for them to continue working with us, because they're extremely valuable people. So the next slide shares a bit of the ideas that we can use in the iceberg to ideate how we can create a healthier, more sustainable practice to enable these communities to stay for the long term, right? So starting with the mental models, we can think that people would like to stay somewhere because they feel valued, they feel they matter, they feel their time, their energy is compensated fairly, and they're an important part of this group. So these are the narratives that we should start with. We shouldn't start with, I don't know, let's have 50 people in the group, because if the values are not there, they're going to leave in the same way as the other ones, right? So we should start with the mental models. So we would like them to say in the future, I am valued. There's always a way to improve my work and my role in this group, and yeah, ideas like that. And then what would then be structures that need to be in place in order for this narrative to be sustained? We would think of a fair compensation. We would think of interrelated work, because that was one of the structures that they thought it wasn't in place for them. So working collaboratively, working with others, and understanding that they are part of something bigger. And also a safe space to work, a space where you can talk to the CEO without feeling like you are under or undermined by other roles in the group or in the company, right? So for that to be there, and once that is there, people, then we go into the level of patterns. People wouldn't leave the group nearly as much as before, right? And they would keep the motivation levels because some of the core structures are in place for them to make sure the narrative continues to be reinforced on the everyday basis. And of course, if that's in place, the events level is of a thriving group, a group that works together, that goes through challenges and understands that the other side of the barriers are success and optimism and great work. So of course, these are ideations, right? This is not how things are going to be translated into reality, but it's important to think on a deeper level, what are the other structures, what are the other layers that sustain a specific practice or sustain a specific event. So this is how I use the iceberg model in a future related mindset, let's say, on a practice that in the same way that we analyze the current situation, we can ideate on what the future can look like as well. So my last slide is really talking about communities, that communities are not just a group of people together, right? There is a lot more that sustains the perpetuation of communities, networks, groups, companies, that if we think long term. So I really like this quote, and I left the resources that I used to make this presentation afterwards, so you can go there and check it out because they're great. But yeah, if I can go back to the previous slide, please, just to finish off the presentation. For us, the Community Weaving Project, the essence of community is relationships of care, held together by a sense of kinship and mutual support. We use the language of community weaving to remind us that we can't build a web of relationship. The community is a living practice, and that our work is to weave and flourishing tapestry of reciprocity. So this is what essentially I'd like to leave you with when we talk about community work. It's not just a bunch of people together doing work. It's really about relationships. It's about care and values that need to be in place for the work in general to thrive and to be held for the long term. So that's a bit about my practice. Thank you very much for listening, and I'm excited for the workshop soon enough. Thank you.
Thank you so much, Yasmin. It was really interesting to hear you take the community perspective, and also just talking about how the core values are really vital to how everything works, how everything fits in together. And also just the utility of the iceberg. It doesn't only help us understand the present state of things. It's also very useful in charting out or planning on creating what a future ideal state might look like. So that was wonderful. I wonder if, since this is interactive, I would like to invite anyone to share some thoughts. What's one thing that has stood out for you from the iceberg model? And you can feel free to put your remarks in the chat, or even raise your hand and unmute yourself just for a few minutes, and then we'll proceed to the next session. I see one question, which maybe Yasmin, you might be able to address. And Chris says people wouldn't leave the group as much as they would leave before. Is there more we could do for 100% retention? What do you think?
Yeah, thank you, Chris. When we talk about people, I think it's very important for us to understand that things change, right? When we talk about complexity generally, but things change, and there's the parts adapt and the parts evolve and change. So 100% retention, in one way, I'm not so sure if that's desirable, because maybe the change is needed, and maybe the change over time is what makes a healthy space to work in, right? um, as long as people feel valued, and as long as people feel like they belong to the greater narrative, I think that's what we should be aiming for. But of course, you know, people have moved to other countries, people have challenges in their personal lives that makes them leave the workspace, but not leave because they feel like they don't matter, but leave because that's part of life, and that's part of the complex experience of life. So yeah, 100% retention. I understand your point, but we can do so much to create the conditions, right, for a healthy environment, rather than guaranteeing that 100% of the people are going to continue here long term, which is part of, in my perspective, the linear narrative that we are trying to go beyond and think about alternatives in this space. But thank you for your question, Chris.
Amazing. So change is inevitable, and it sometimes is necessary, and it's part of the experience. I'd like to see if there are any more comments before we move on. If not, we can proceed. All right, I think we can proceed. And so now we're going to go into the panel discussion. Thank you so much, Yasmin. And we have some real experts with us here. We have Emmanuel, who works with Food for the Hungry, and he is the M&D coordinator there. We have Anne Carrao, who is the Global Systems Practice Lead at Food for the Hungry, and Ivan Terry, who is the Director of Program Optimization and Acceleration at EGPAF. So they're going to share a little bit about their experience, what they've learned, and what works best usually when we're talking about systems practice within their fields of work and of influence. So I hope you're all ready. We'll just, maybe perhaps we can take turns and introduce ourselves, starting with Emmanuel, and then Anne, then Ivan, and then we'll go on with the questions. So over to you, Emmanuel. Hi, Emmanuel. Please unmute yourself.
Oh, sorry for that. Can you hear me now? Can you hear me now? Maybe. All right.
Yes,
Maxi.
yes, we can.
All right. Thank you, Maxi. So I'm Emmanuel Muli, Dr. Emmanuel Muli, currently with Food for the Hungry. I'm the M&E coordinator. Experience systems practice. I'm supporting different countries around the world, which is Rwanda, Indonesia, Mozambique, Burundi, and even Haiti in systems practice. I'm glad to be here, at least to share with you my experience. So that is it. Thank you.
Thank you, Emmanuel. Anne?
Yeah, good evening, everyone. My name is Anne Carroll, and I serve as a Global Systems Practice Lead at Food for the Hungry. So I'm just really passionate about systems practice and systems thinking. So just constantly pushing the needle. And I thoroughly enjoyed your conversation, Yasmin, and the applicability within community context. So I'm looking forward to this conversation.
Thank you so much. And Ivan?
Hi, everyone. My name is Ivan Terry. I'm currently the Director for Program Optimization and Acceleration at Elizabeth Glaser Pediatric AIDS Foundation. I'm here on my individual capacity, so please don't quote me as working on behalf of ECPAF. My experience has been in quality assurance, quality improvement, and optimization of systems at the program level. I have been with working in this sector for about 15, 16 years, supporting about 17 countries, mainly in Sub-Saharan Africa, with the focus on HIV/AIDS through PEPFAR programs, but also working with Global Fund, WHO, Bill and Melinda Gates Foundation to work with a lot of ministries of health in those countries to set up their national quality improvement programs, which are really focused on building stronger systems. Looking forward to learning today and talking to you all. Thanks.
Wonderful. Thank you, everyone. And so the first part of our conversation will be a bit more focused on understanding the system and what lies below the surface. And I'd like to pose my first question to Emmanuel. Your work at Food for the Hungry, which works in humanitarian development, there's a bit of work around poverty reduction. What patterns or trends have you seen in this space in the past 2 to 3 years?
All right. Thank you for that question. Yeah, our work about on poverty reduction, we've seen some successes in this era, and especially post COVID-19. There was really great successes. However, COVID came, and the good work that we had done was swept away. Right now, we are up at it again. Right now in Kenya, we have almost more than 20 million people living below poverty line. That is below $2.15 a day. And even in other areas like in Samburu, Marsabit, we have more than that. We have more than 72 people. That is around 7 in 10 people, more than 7 in 10 people living below $2.15 a day. And the trend is the same globally, more than 700 million living below $2.15 a day. So when we use economic lens to describe poverty, there is an issue. The stability, we are seeing a trend where the stability is not there. It is unstable. We make 1 foot forward, 3 steps behind. So there is this trend where some organizations have have expanded their understanding of poverty. And I'll give an example of Food for the Hungry. We have expanded our understanding of poverty, not only to be at the lens of economics, but also to encompass other components. And we realize that how we understand poverty really determines how we respond to it. It's how our assumptions we have, our beliefs we have, the values we see in poverty, it will determine how we respond to it. So we shifted gear from the deficit approach to a systemic approach. The deficit approach, which just tackles the symptoms, to a systemic approach, which tackles the root causes. So this trend is not only Food for the Hungry, it's a trend around the globe. And the trend of dealing with only symptoms of the deficit approach is dangerous. Why? Because you will only be thinking. Let me give an example of how we define poverty in Food for the Hungry. We see poverty as a broken relationship between God and yourself, between you yourself and yourself, between yourself and others, and between yourself and nature. That's how we see poverty. We see it as an interconnected wholeness. It's complex, so that you can take an example. If we only dealt with economics, or our understanding of poverty was only on economic terms, that means what we'll be doing is increase cash in the pockets of people. We'll be advocating for increased incomes at household level. At the expense of what? We will forget the relationship we have with nature. We will forget the relationship we have with ourselves. We will forget the relationship we have with God and the relationship we have with the nature. We've all seen what happens when we increase profits at the expense of relationship with others. And I want to give an example of what is happening right now around the world. We have conflicts. Russia is a superpower. So we will say that there's no poverty as much compared to African countries, but they're not at peace. They are fighting. I will give so many examples when I go to relationship with nature, and that. So the trend in which some organizations and governments around the world just are making sure that they expand their view on poverty is a positive feedback loop that should be encouraged. Thank you for that.
Amazing. Thank you so much for that perspective. I like how you talked about
I think we lost Mutile.
So over to the next question, which I will address to Anne. What do you think may have led to the widespread practice of only looking at the symptoms of issues and not the underlying structures and beliefs that perpetuate them?
Yeah, I think many of us are well-meaning. It's just we want things to be better. And I was reading somewhere, it was saying the biggest cause of unintended consequences is a fix-it approach. So you just see this issue and you just want to fix it. So I think, many of us are well-meaning, and because we want to take that fix-it approach. But I think also because of a lot of the paradigms we've been socialized with and continue to be, that we continue to hold. Some of them are linked to quick fixes, like if you do this, I can help you sort this out. Just quick fix. So sometimes we just want it to happen very fast. And sometimes also one of the paradigms we hold, and I think we've been cultured so much in school as well, is to be analytical, to break things into parts, to understand the part and then fix that part, and then everything will work, just like a clock. So I think some of these paradigms are what are driving us as a sector, as individuals, even at home. If you see your child is misbehaving, so you just want to, let me just pinch or cane, or depending on the context, or time out, depending on whatever context. So we just want to see a problem and fix it. We think that if we just address this part, everything else will work out. Everything is just one big clock that we are trying to fix. And I think that's basically why it's happening. But at the heart of it is really well-meaning. And, what we actually need to do, just as Yasmin alluded to, is, take a step back and see, okay, this is what I'm seeing. Why? How is it connected to everything else and everything else and everything else? Yeah, thanks.
Thank you, Anne. And I think that response, as you've said, creates another problem for us to look at through the systems iceberg. Why exactly were we taught to be so analytical and break things apart? So the layers keep growing. Thank you. And to Ivan, please tell us a bit about the work you do in global health systems and some of the key health events that you have encountered in your career.
Thanks. Hard to follow the other groups, but I think I'll use Yasmin's framework because she really put it well by showing us the iceberg model. So essentially, our work, and my work particularly, has been around looking at events. In my case, I work in HIV/AIDS. You look at how many people are not receiving treatment, how many children are not virally suppressed, how many pregnant women are passing on HIV to their infants. So that is an event. Then again, looking at that iceberg model, my job and the job of my great team that I've been working with for so many years in different countries was then to go deeper. So really dive down. I think we're not all great swimmers, but you have to now dive into the water and hope to actually come out with something. So what we've done, for the most part, we have looked at patterns. So we have things like run charts. We deep dive into data and analysis to see whether there are trends over time, to see whether these are just one-time outliers. And then we also then go to the next level. Now that's when we start using tools such as process mapping, because now we're looking at the structures. So, okay, we have seen the problem, we have seen the data. This is something that we need to look into. So to really look at the structures, the tools we have used, and we really train our staff on, is process mapping and flowchart development, root cause analysis, so using the fishbone diagram. And to go back to Anne's point, is really looking at, is it the environment, is it people, is it structural management, is it equipment? And then really that's where people's eyes start opening up, because initially they were thinking, okay, this, maybe these people are dying. Now they're starting to understand maybe why they're dying. But in that exercise, you then start learning that those mental models are there. And I'll admit that I only learned about mental models recently, but actually what was happening is you find healthcare workers as demotivated. They're not feeling valued. They don't see their piece as a part of a larger puzzle. They don't feel very supported by management. So then you find that you're not, you're working with them thinking I'm addressing stockouts, but actually some of the issues are around feeling supported to be able to provide medicine to patients. So then that's when we started then doing that inversion that Yasmin was talking about. So our job is really to move us back up there, that now we start preventing those deaths, preventing that HIV transmission to the children. So we've, in terms of the health event, obviously COVID affected everyone. So we really tried to hunker down and use these tools to get the systems back up and running. And also to ensure that we're kind of building more resilient health systems. So the good thing about this exercise is the further down you go, you're getting, and the more critical mass of folks who are doing that exercise on a routine basis, you then start building some understanding, which usually builds resiliency. And then all of you work your way back up to ensure that you get good health outcomes. Thanks.
Thanks, Ivan. And I know health is particularly sensitive, so I can imagine there's some challenging conversations that you've had, and that is at the core of systems thinking in any case. And moving on a little bit, I wonder, Emmanuel, if you have encountered any unintended consequences due to an approach where only the events were addressed without understanding the system?
Oh, yeah. Thank you for that question. Yeah, so let me start by saying that unintended consequences will happen whether or not you are using systems practice. The advantage of using systems practice and systems thinking is that you will be able to know them in advance and work to mitigate them. The advantage is that you will do what we call scenario planning, and you will know what you are likely, the negative unintended consequences you are likely to come up to cause, and you will reduce the likelihood of those happening. You will also find the positive unintended consequences and encourage those to happen. All right, back to your question. Let me talk about one of these unintended consequences that very many projects, especially in humanitarian sector and development sectors, just bump into, and that is dependency syndrome.
Looks like we've lost Emmanuel for a minute.
I think someone cut him off after he was starting a controversial topic.
The system worked against him. Okay, we'll come back to Emmanuel. So let me maybe move to Anne. To you, Anne, how do you maintain the balance of addressing immediate needs versus designing longer-term solutions, which are essentially what we want with systems change?
Yeah, so first of all, I think it's important to clarify that there's nothing wrong sometimes with short-term actions. Sometimes it's what is needed. I think one of the big anxieties, like when you get into systems thinking and systems practices, that you start thinking, now I have to be super, this super person who always digs deeper and is doing everything new. I'm innovating all the time and so on, but that's not the reality. Indeed, there's a balance. So I want to say that there's something Emmanuel said when he started, before the system worked against him. He said that how you understand a problem will determine how you address it. And I think that that's the trick. So you might have a short-term response. So for example, there's an education issue and you've done your analysis, but then there's a benefit of, a school fees intervention. So you're doing a school fees intervention, but for you at the back of your mind, it's not the beginning or an end all of addressing that issue. Maybe it's catalyzing something, or you're thinking about it in the context of something larger. And even as you're doing it, the school fees intervention, you're thinking, what about the parental role? What am I communicating? What are the risks around this and so on? So I think it's just that balance. So take time to step back and understand this issue. Like we've talked about, take time and understand, it a little deeper from the structural level, from the mental models level as well. Then even if you're doing a short-term intervention, it's in the context of a larger thing you're thinking about. It's in the context of maybe even orchestration. You're thinking about who else can do something. So yeah, that's how I think we can create that balance, but not to come afraid that every short-term. So if you ever see anything that's 3 months, 1 year, you're like, no, we can't do that. It's not systemic and so on. But really balancing that with the realities that, okay, I understand the grand scheme, I understand the interconnections of things, and I will begin here with the intent that it can trigger this. Yeah.
I really like that perspective, because it's not always that we'll have the resources, whether financially or human capital, for long-term change. But yeah, people's needs sometimes are pressing. And so once you contextualize that problem in the system, then a short-term kind of intervention is the best way forward. So Emmanuel, you are back. So you just said that the system worked against you. So
Imagine.
continue.
Sorry, everyone. So I remember the trail of my thoughts, thankfully. So dependency syndrome, this has had very many NGOs really trying to see how will we come out of this. And Donella Meadow calls this shifting the burden to the intervener. Like, you are there, you want to help, but now whoever you want to help just tries to come back again and again forever, which it creates issues of sustainability of whatever is happening, whatever the intervention we are doing. So as an organization, it gets us thinking, what are we supposed to do? And that's why we are now getting into systems practice to try and see how can we come out of this. And this dependency syndrome actually happens because of transactional nature of our interventions. We pay school fees, we cash transfers, food distribution, we do that without doing what is called the scenario analysis. We will get this unintended consequence. And one of the disadvantages of dependency syndrome and just acting without scenario planning is that we will bring suffering. We will take away the ability of the community to fend for themselves. And you know what that happens. For years, they will want to come back to you. So that is just one. There are very many unintended consequences that are faced. Back in my other life, there's this project where we were supporting lactating mothers with food nutrition, cash for nutritional supplementation. We give them money so that they can reduce the malnutrition in the children. You know what happened? We had lactating mothers trying as much as possible to make children remain in the category of people that are acutely malnourished, so that when other NGOs come, they also get the cash, and we know what that can do to the health of a baby. There are very many examples, but let me just stop at that. Thank you.
Thanks, Emmanuel. That was quite a stunning example that you gave. And yeah, just how complex humans are. The system is complex and the humans themselves are complex. So I think it's just learning this practice of digging deeper, trying to understand, because perhaps there was a mental model and a belief around why the mothers were acting in that way. And now back to you, Ivan, and the conversation on health. What are some underlying structures and beliefs that you see perpetuate health problems?
Yeah, thanks. I think I'll mention three. One of them will be to add to Anne's point. But the first one is really thinking that the health sector is working in silo, and that health sector is only solely responsible for health. That's been a huge problem. I think when folks think about health, they're thinking hospital, they're thinking medicine, they're thinking doctor, or some traditional healer. So that is I would say, a mentality that many people hold. And therefore, they go about their lives up until they say, oh, I need a doctor, or I need a nurse. Whereas I think for us to avoid a lot of health problems, we need to take it back to education system, self-care, prevention, but that requires a lot of sectors coming together. So agricultural sector, we know that some of the fertilizers we use have X amount of consequences. The industries that we work in, for example, manufacturing industries, we know that they'll have X amount of consequences. The transport sector will have health amount, just accidents themselves. So all these are interconnected, but we have somehow siloed healthcare and said, when there's someone's poor health, then this is the only sector that's responsible. So a lot of advanced structures have identified that all these are interconnected systems and created pathways where there's a lot of information flow, there's a lot of action between those different systems. Then you're reducing accidents, you're reducing pollution, you're reducing inadvertent kind of health problems for your population. The second one is lack of investment in prevention as well. A lot of societies that are thriving economically and otherwise are really working hard on the prevention side. I think all of us see healthcare as treatment, but actually I'd argue that 99% of it is prevention, not getting there in the first place, whether it's through healthy habits, whether it's your diet, whether it's an enabling environment where you feel safe, you're not attacked. There's so many ways that we need to do. Again, we don't always think about that. Well, those are really creating huge problems. To go back to kind of what Anne is saying, and I see Chris is also supporting on the chat, the short-term thinking or solutions are great and always needed. Right now, for example, we're in a stressful stage in global funding for what Emmanuel has termed as our dependency. So we're obviously coming up with some short-term solutions. However, I feel that the further up you go in terms of your work and where you sit, you have not just a moral responsibility, but actual responsibility to look more at the system level. So, for example, I know a nurse seeing 1,000 HIV patients a day at the height of HIV has no time to really start looking at how the different cogs work and how this different industry affects my healthcare and all that kind of stuff. But I think as a district health manager, as someone at the county level, as someone at the national level, some of us in our roles, we do have a responsibility to, even whilst making short-term kind of decisions, using a lot of these system thinking tools to know that we're looking at things more holistically, but also I'm going to make this short-term decision, but there is this longer-term plan. There's this more wider picture to this. Thanks.
Thank you, Ivan. I think a couple of people here have just talked about understanding the problem, understanding the people, and what is the appropriate approach. So, yeah, you've very rightly mentioned someone with an intense workload at the hospital doesn't have time to think about the system. They're just really addressing the immediate need of someone who requires a blood transfusion or whatever it may be. Yeah, and this is, I think, a good point for us to remember, because as Anne mentioned, we get kind of caught up in the idea that everything has to be long term. But yeah, everything in moderation and with good principle, with good practice, and keeping the people at the center of everything that we do. And just a final question to anyone who might have a response, and maybe it could be popcorned within yourselves. What do you think is something missing in the systems practice conversation, particularly in the African context? If there are any concerns you have, any ideas for this one, I'd like anyone to go. Any
Can
takers?
go first on that. Yeah, so I feel like there's this systems analysis, there's also solution analysis, and I feel that we have concentrated more on system analysis, and I think there is a conversation that is needed on solution analysis, because we've done a great job looking at the patterns, of the system structure, the habits of thoughts that perpetuate behaviors in the system. Then the moment we get the places in the system to act, we jump right into a solution. And African context really needs more than that. So we need solution analysis, and we need to have equal weight given to solution analysis, just like it's given to system analysis. Rest, we will have wrong solution for the right problem. That's what I feel the conversation. We need to balance the conversation. Yeah, I think that's what I think is missing for now. And especially in African context where it's complicated. Let me use the word complex. African context that is complex. We need both local problems and local solutions. And that will require a more time given to solutions analysis. Thank you.
Thank you, Muli Ann.
Yeah, I think for me, it's maybe we focused a lot on the hard structures and we are so relational in Africa and forgotten, just to take time, like even to surface, mental models in things that we are doing. Like we have rushed to the solutions from the hard systems point of view and not taken enough time to just remember people in the center and how complex they are and how interconnected they are and how they might be thinking. Because I think sometimes maybe some of the solutions would not be as far-fetched as we think. They are just within there. And then we've also really tried to manipulate the system as opposed to just a small actions, not trying to do everything to change the system itself. So those are my thoughts. But I do think that in general, sort of like as a parting shot, I don't know whether this is the point, that it's also important that we all, like, I'm so excited about 38 people here. Yasmin jumped on this call so fast. Ivan, he's doing his day job and his other life here. Just I think more of us need to have these conversations on systems practice, demystify, simplify, just engage with these concepts, because that's what will cause this transformative change that we are looking for.
Lovely. Ivan and Yasmin, any thoughts? Sorry, Ivan, I don't think we can hear you.
Oh, sorry. Adding to that, I think Emmanuel and bring up really good points. For me, the two things that really resonate. One is responsiveness, and another one is going to Emmanuel's point, the solution part. The solution, what I think, and this DeepSeek issue has actually resonated really well with me, where they took a solution. This is the AI models they've built out in China, and said, how can we build something with our own limited resources? And again, this ties back to Emmanuel's dependency point. I think we didn't have a choice in Africa 60, 70 years ago when our systems were disrupted. We had some sustainable practices. Yes, we had probably just the same amount of death as anyone had elsewhere. We had the same amount of maternal mortality and so on. But we had developed systems that, for us, made us a sustainable, I'd say, continent and a people. And those were disrupted. Now, 60, 70 years on, we are seeing this dependency where some more expensive models, some models that maybe don't really work for us, as Anne mentioned, they're not really for the people. They have not been developed by the people. And we're trying to fit that in somehow, and it's not really working well. So I think we need to go back to that solution development with that mindset that maybe DeepSeek had of, what really works for us? What can we do with our own resources? How can we build over long term? And we have some examples of countries that have done that. So we just need to do that at a wider scale. I know Maxi has talked about, our centralized power versus shared power, and we know a lot of our power has been centralized, again, taking systems that perhaps don't work for us. Then the other thing for me is the responsiveness. Anne talked about how more people being aware of some of these skills, this thinking, and then able to respond. But I think what she was alluding to was action. So that, by us jumping on this call, by us having this discussion, we're actually taking action. I think what Didi is doing and the others are doing, that's action. So I think if we develop those solutions, we need the responsiveness of the leaders, of the people in the right places to actually put in policies to actually move in that direction. But as we know, we all discuss, if I sit down with Emmanuel at having some nyama choma, he'll come up with so many great solutions. We'll even have feedback from the waiter, and the waiter will have fantastic solutions. But those, once they trickle up, somehow it's just very much misaligned with the motives of some of the people who actually hold that power. So how do we get to be more responsive, especially once we have power to do that and make that change? And I think that in the end will affect then the systems and the structures, and everything flows that way. Thanks.
Thank you. Again, coming back to the issue of power shifting. Yasmin, any thoughts?
Well, I definitely not the best person to talk about the African continent. But what I feel generally in the systems practice is a conflicting narrative that is not necessarily conflicting. We're just using different words or different languages to talk about the same issues from different points of view. So I think with this solutionist perspective, let's say, or this quick fix mindset, sometimes we don't have the time, but we don't take the time to hear the underlying issues that people are experiencing and talking about. We just jump into you're wrong, or you just jump into this is not how things work. But deep down, we are a lot more connected than we think we are. It's just that on the surface level, we're just trying to find ways to survive and to do what we have to do on a daily basis. So yeah, I think the narratives that underneath the surface in this iceberg idea is the same and is very related and connected, but on the surface it seems like there are several different narratives happening at the same time. So we find it difficult to get to a common ground and to align our goals and values to then act together, as Anne was saying before. So yeah, I think it's just going back to the idea of mental models and narratives and cultures and so forth.
Thank you so much, panelists. Very fruitful and insightful discussions. A lot of talk about taking the time, even when we don't really have the time, when we don't have the resources, just to really understand the invisible parts of the problems that we're facing. So that's it, panelists. You can now rest. Thank you so much for your sharing and perspectives. We are going to start to transition into breakout groups. And for this section, we are continuing the discussion on the systems iceberg. Sorry about that, which is just a tool that helps us to surface what lies below the surface. And yeah, so as we have seen in the previous video, there are 4 levels of the iceberg. At the very top, we have events, followed by patterns and trends, structures, and then mental models, which includes the beliefs, the values, and the assumptions that we make. So in a few minutes, we're going to be put into breakout groups. I'd like to ask Liz if those are ready. And within the breakout rooms, we're going to try to apply the systems iceberg model with drought as an anchor, because drought is such a huge problem in sub-Saharan Africa. In the past decade or so, it has just become sort of like a menace to people, especially poorly resourced communities, marginalized communities. And so we're trying to understand what that looks like, and break it down, even as people who work in development and social impact, to what are ways that we can think about drought differently and what might potentially be some solutions, like has been alluded to by Emmanuel and the rest of the panelists. So Liz, are the breakout rooms ready?
Just 1 minute.
Great. So we're going to have about 5 breakout rooms, which will be facilitated by your very able panelists. And they're basically gonna share some prompts and help you understand the iceberg deeper, but also help it make sense through the analogy of drought within Africa, within whatever part of the world it may be. And if need be, you can even use a different example on which you anchor your discussion. So once we're ready, we will go into the breakout rooms. as we wait, I'm happy to invite anyone who has questions for the panelists or remarks and thoughts to unmute yourself or type in the chat.
The rooms are open, so can
All right. I hope you all enjoyed your breakouts. Let's give a minute for everyone to come back. Few people left, and then we will share our learnings. I think most of us are back. And so what we're going to do now is share a bit and reflect upon what we spoke about in the breakout rooms. Each group or team will have just 1 minute to talk about their discussion. And so maybe we can start with your group, Yasmin. You can either speak on their behalf or invite someone to speak.
Yeah, thank you, Mutil. We had a very nice conversation. And just a couple of notes that I took from what we talked about. So we have, for example, in the events level, death of livestock, people losing jobs, shortage of products in food markets, or increase the prices of food commodities, and so forth. Then below that, in the patterns, it was interesting because there's a pattern that it is, for example, the constant droughts over time that people haven't created then in the structure levels enough structures to deal with it, even though it's a repeated pattern. So then we understand that in the structures there's fundings and incentives going somewhere else compared to going to creating the structures for to deal with the constant droughts that happen. And then in the mental models, we talked about the convictions from citizens about divine intervention that brings drought to the citizens rather than fighting for a better structure from the government, because of this belief that it's a divine intervention. So this is one side of the thread, and on the other side we had, I'd say from bottom up, the future would be an Ubuntu type of mindset that would bring people together and understand that if you are suffering, then I'm suffering as well. So we all need to come together and collaborate. and then the structures and the patterns will follow from that. And then, of course, having events that are a bit different than what happens at the moment in the droughts. So yeah, very interesting. Thank you, room 5, for the conversation.
Thank you, Yasmin, in room 5. I see Anne on screen. So Anne, would you like to share?
Yeah, I'll call on Linda to share, but just one thing, just a thread from what Yasmin said. There's a deep mental model we discussed around, like, what can I do about climate change? Like, drought is recurring, but what can I do? I'm just in my village, and that came from Linda. So I wanted to invite her to just talk a little bit about what stood out in our conversation. We also had a really interesting one. Linda?
Yeah, sure. Thanks, and thanks, Yasmin. Okay, so yeah, we started off looking at the events of, or like, what is it that we see at the surface when there's drought. We talked about malnutrition. We talked about migration, like people having to move from one place to the other in search of food. And yeah, and then the patterns, we spoke about the weather patterns, what we're seeing as the extreme weather events going on, like storms. We have where there is extreme temperature rise. It's very high. Where it's cold, it's extremely cold, and we're seeing that recurring more and more. And then we also talked about obesity, because once there's drought, there's also food aid coming from different places, and some of the food is coming from places where GMO seeds are being used to produce this food, and there's an effect on the health of the people receiving this food. In terms of policies, we spoke about the aid policies related to, when there's drought, some countries need to then get food from other countries, and there are policies to be put in place for that. We also spoke about land and water use and management policies, and we also talked about land deforestation around, like what policies can be put in place to ensure that our forests are kept in place to also deal with the issues of drought. And then at the mental models, like Anne mentioned, there's that issue of individuals feeling like they do not have anything they can do, and looking at the issues related to climate change or drought being the problems of NGOs or government or other bigger institutions. And then we also spoke about we also spoke about the thinking about immediate solutions, and not, people not thinking too far ahead. So if we have a problem, we just react to what we see as a challenge right now, and we don't really look into the future. And so that causes, people to look at climate change or drought issues as, as an emergency all the time. Yeah. My team members can aid if I skipped something, but yeah, that's what we discussed.
Thank you so much. What you talked about is how it's not my problem. The idea that someone else will deal with it, that's quite a challenge, and one that requires a systems analysis in itself. Maxi, would you like to report on for your team?
I would like to call upon one of my colleagues who is from South Africa, Asan Ngombe. He provided a good actual case study of something very similar that happened in Cape Town. So different context, but very relevant. And so Asan, if he's joining us today from Joburg, so if you can kindly just give the example that you gave from Cape Town.
Thank you so much. Yeah, it was an interesting conversation. We started off by trying to understand the kind of system you are dealing with, because they are human systems, and they are also natural systems. The systems that are set up by human, like an organization, but also systems that just that exist. And as you're dealing with a case, looking at the environmental stuff like that, like the drought, we went down to try and unpack those patterns, speak about the structure. So the case that I gave was the drought that hit South Africa, in actually Cape Town, not the whole country. It was Cape Town in 2017. It just came out of nowhere, and people were saying different things. They were saying it's climate change, and now you deal with a system that is like beyond human beings' control. Like you can't really control it; just came like that. So what we noticed, like shortage of water, we didn't have water. People were driving long distances because it was in the middle of the city. We couldn't really speak about shortage of or crop failures and stuff like that. In some places here in rural areas, we did have problems like that. So in terms of the patterns that we saw, as I said, high temperature in terms of climate, but that was going also seasonal, taking long time for people to recover. But more and more also linking it to the events, the way people had to travel long distances to go access water, it was becoming difficult. And at the structural level, the government had to respond, they had to think of local and provincial government had to find the responses on how to revise their policies about usage of water. I was talking about how we had to shower. There was a rule that was given to say 1 minute. So you get to the shower, just open, just so that you're wet, and put soap, and then just so that reduce the way people are consuming water. And that was linked to the mental model now, because there was a campaign where they had to convince people to change the way they think, the way they act, the way they use water. And it was quite challenging because in some places, if you look at the city, for those who know that South Africa is facing, it's been this inequalities, there will be places where people have access to resources and other places where there is no limit, like limited resources, like access to water. So in some places, people were resisting to that. They were saying, look, we always have been living without water. And now you come and tell us that we can't use it. So there were those kind of tensions in the community, and the government had to play a key role by just driving programs in the community, even on television, using media to try and sensitize, to get people to shift their thinking in a way that is more towards saving the little resources that they had, so that the tanks that they have, they had in the province, do not completely run out of water until it started raining. So the example that I was using is that, like that, I was saying that if you look at the issue that you are looking at how is it coming from? Is it a situation that is beyond humans' control, like something that is not created by human, like just the environment? It can be human, but to a certain extent, when you say, for example, our action and how is that contributing to climate change. But when you're dealing with things that are direct, so also the way you think about it, the way you approach, the way you think of the intervention should also be according to that. So that was something that we shared and we discussed together as a group. We had a bit of technical challenges, but it was an interesting conversation. Thank you so much.
Thank you, Asen. Maxi, any additions?
We, as you said, especially the aspect of what can humans control and what can't human controls. Time cut us short, so we weren't able to unpack that fully. But it just goes to show that there is the principle and the systems thinking itself as a practice will enable us to know what our leverage points are. And if there's something that, especially in a drought situation, we can't control, I guess is what I think Anne was mentioning before. How, if this is if this is getting repeated every so often, every number of years, and yes, there's climate change and all of those other things, fundamentally somewhere there is a practice that human beings have been doing that that requires to we require to shift a little bit of how the practice around that has been going. So yeah, I am excited that this gets to continue to be part of conversations that we can explore even as we continue ahead.
Thank you to Maxi's group. I think we have Emmanuel left. What came out of your group discussion?
Thank you, Mutile. I'll invite Ivan. We were together with Ivan in the same group. Yeah.
Thanks, Emmanuel. I won't, because of time, I won't repeat what I think everyone has now covered, being last. I've shared our discussion in the chat. I think it very much mirrors what others have been mentioning. I think one point I'd like to make, and then I'll also invite any of my group members to maybe mention anything that resonates with them. But Dr. Muli mentioned something around, if you don't go deeper, you'll respond to migration or you respond to providing seeds. So really it resonated by saying we have to be careful when we're using these models, not to be too narrow, because you're using a model, you're excited, you think you're being analytical, but actually you're going down a path that maybe you may not be able to come back from eventually. So you have to keep an open mind all throughout as you're going into kind of the deep ocean. So when you're looking at migration, if you're looking at rainfall, if you're looking at vegetation, you have to go down all those different paths up until the end to find all the different mental models. And then you have to do prioritization, which is a huge, huge part in systems thinking. Things can get overwhelming. You can have so many solutions. You can have so many problems. So you just have to slowly find a way to prioritize and then kind of address those issues. So I thought that was a very important point. Otherwise, you'll end up kind of really just thinking you're using the tool properly, but you're actually very narrow in what you're addressing. So I'll welcome any other members if they have anything to add in terms of what we discussed. Back to Emmanuel, if you have anything to add.
Thank you, Ivan. I won't add a word. Thank you for sharing whatever we discussed on the chat. You can also, I invite everyone maybe to just go there and check whatever we discussed in written. Thank you.
Thank you all. I'll report briefly for my team, but also I'd invite Rosalind, who talked about family planning. Basically, we had a lot of the same responses, things like at the events level, there's no food. The crops have failed. People are moving. Migration is happening because they can't access, their basic needs. An interesting one at the patterns and trends level was there's a rate of increasing non-responsiveness or defaulting in nutrition programs. So just because people are migrating into new places, then the nutrition programs become overwhelmed. So again, we just saw the connections between each of these individual elements at all the levels of the iceberg. Yeah, I think I'd like to invite Rosalind to talk about family planning.
Thank you, Uchile. So this one was the perspective of they're not responding in terms of the services that are being offered for family planning at the clinics or the outreach sites. That's because either they're migrating or they're not looking at it as a priority. Because for them it's they're looking for food at this point in time. And therefore, you find that even other, not only family planning, other reproductive health services, like maybe if it was cervical cancer screening, for them that now is not a priority. So even if you have got outreaches in those sites, it's like you're going to a dead site, so to speak. Yeah.
Thank you. Thank you, everyone, for contributing and participating. This is pretty much the end of the discussion today. We are slowly wrapping up. And yeah, I think at this point, I'd like to invite Maxi to take us through the closing share some thoughts and what things look like within the next few months.
Thank you, Mutile, for hosting this. This is the second in a series of systems thinking, systems practice conversations that we're having in last Thursdays. And as Fel mentioned at the very top, last Thursdays happens every last Thursday of the month. So we are glad that as a community of practitioners, leaders in the spaces that we find ourselves in, largely in the development space, in health mostly, and then also in various other intersectoral areas, that we can have this kind of dialogue every so often and come in to think together and learn together and share. And so I'm really grateful that we are building and we are continuing to build the momentum. And we want to find out from you what kind of topics you would love to be covered in this kind of series. So if there are topics or conversation points that you would really benefit from, we would wish for those you can mention those to us, and we will definitely factor them into the year. We try and plan 2 or 3 months in advance. So we do have what's coming up next. I'll just ask for us to go to that next slide. This coming month, in the month of February, we are still going to continue the third part of this series, and we have a couple of, as a build up to this one, we'll be doing the third part in this series. And the first one, when we introduced the concept, this one we've discussed and explored a bit of the tools, and we'll share the outcomes from this. This last one will get really granular to get us to move from the place where, I guess this was coming up in the discussion earlier, where all of this can sound a little bit too much, and especially where the tools and most of the panelists and the conversations that were happening on chat, we were all challenging the fact that, and that's what also Even has mentioned at the end, how will we do systems analysis or solutions analysis? Will we overanalyze to the place where we can get paralyzed by the process that we are doing? So we will be seeking to really come up with actionable ideas that can help our actual work in the context that it's set. And therefore, we are glad that we can continue for the third month in a row, just to partner with Food for the Hungry. And we already have a couple of guests confirmed for that. And in subsequent weeks, we'll be sharing what that looks like. Then in the month of March, we will shift gear a little, and we will move on to something slightly different. Given everything that is occurring in this space and in the current ecosystem, we want to really dig deep a little and find out, where does impact management go? So the month of March is marked as the Be Impact Month, and we are sort of going to analyze across ourselves and in build up to the day itself, and also on the day, we're going to analyze what are the impact tools, impact assessment tools that exist, and how we can use those to better strengthen the systems within our own organizations, but also the systems within which our organizations tend to respond. So look out for the invitations for that, and also for just a quick summary from this one. So in the last 3 or so minutes that we have, anyone who we just would like to open it up, maybe you can share via chat any topic that you would love us to consider as we are moving forward into the subsequent months. You can leave that either as a chat on the chat place, and we will we'll be able to discuss how to make that work, and maybe also reach out to you to explore a little further. Feel free to drop that, and also all reply on the email that you will receive within the course of the next 24 hours from us, just thanking you for this. But I would love to thank us all, and I would love to also thank Mutile and the panelists who have made this possible. We are grateful, and Food for the Hungry Kenya, we are grateful for the partnership that has been now continuing since last year. Thank you very much. And over, I guess we can end the call.
Yes, thank you all. We hope to see you in the next one in February. And yeah, look out for communication from us. Have a great rest of your day.